Well, happy, beautiful, amazing day. Dr. Bob Rakowski here with our next podcast edition. I've got superstar doc, Dr. J.T. Anderson. He's an author. He's chiropractor that's worked with the Denver Broncos for a number of years. I want him to tell that story. And he talks about different things called power partnerships, where he's learned to really connect with the community in a meaningful way. But there's also power partnerships within the body. So he balances the structure, he balances the energy. And I think he brings amazing energy to the table. So welcome, Dr. JT.
Thank you, Dr. Bob. I appreciate it so much.
Now, I should ask you first, what do your patients call you?
Well, Doc JT primarily.
Okay. And that's why you use that as your LinkedIn following. I like it. Keep it simple, flows nicely.
Thank
so
you.
Let's go to your backstory. I know it, but there's people that are going to be exposed to you for the first time. So how in the world did you get your calling?
It's interesting. I wrote a book called No Bones About It, a memoir of a chiropractor. And this whole story, and we all have stories, Dr. Bob, and of course you do have yours as well. I decided to write mine, and it's been an amazing 30-year journey. But when I was 13 years old, I was out in the sandlot, basically throwing a football, and my back went out on me. It dropped me to my knees, and my friends had to carry me home. About a week or so, I was gingerly just making sure that I didn't overstress my spine, decided to go ahead and make another run at it in the sandlot again. And lo and behold, I went reared back and I threw a pass, and my back went out on me. So at that moment, I knew that I needed to build strength. So I started bodybuilding, started lifting back in that early years, about 14 years old, moved to Southern California. And while I was starting to compete, a chiropractor tapped me on the shoulder and said, "Did you know when you squat, your right pelvis is much lower than your left pelvis?" And of course, I didn't know that. He said, "I'd like to bring you into my practice, and I would like to take some x-rays." And sure enough, I have some congenital anomalies within my spine that are definitely something that I'm going to have to live with. But I've overcome those barriers. So through a course of about 8 weeks of treatment and therapy, I started noticing that I didn't have this chronic lower back pain. This was about 15 years old. And I started thinking to myself, well, gosh, maybe this is a profession I would be interested in. So going through college, athletic training, physical therapy, and chiropractic were the big three front runners. And I did an internship with a local sports chiropractor. And I just knew that that was what I was supposed to do.
Well, this local sports chiropractor was connected on a very high level. So I want you to talk about that a little bit as well. So who was this guy and who was he connected to?
Yeah, his name is Dr. Gabe Foster in Greeley, Colorado. Greeley is known for basically it's a meat packing plant, but that's where I met my wife, and I was a personal trainer at a local gym. And Dr. Foster just took me under his wing as I was going through my schooling. And he said, "Look, you can be an athletic trainer and a physical therapist, but you're always going to have somebody telling you what to do. As a chiropractor, you can diversify. You can focus on nutrition. You can focus on energy work. You can focus on physical modalities." And it just really hit home that I could be my own boss. And I'm certainly glad that chiropractic has been my career choice.
And then when you were at Parker, you also had a residency or an internship, whatever you want to call it, with the Dallas Cowboys team chiropractor.
Yeah, that was very unique because, a lot of us at that stage in our lives, we were very impressionable. And I happened to meet the Cowboys chiropractor, and he invited me in, and I started just doing some basic things for his practice a couple days a week. And that lasted for a couple seasons. And that was when they were at their peak. They won 2 Super Bowls. And so I had a chance to meet some of the greats of the Cowboys.
Well, I mean, that was the heyday that those, and most of us in Texas, look for those again. Now we have the Texans here. Back then we had the Oilers. So it's pretty fascinating how that professional sports has evolved. But how did that springboard into then you being team chiropractor for the Broncos? And that was pretty rare back then when you did it, wasn't it?
Yeah, there was only 3 licensed NFL chiropractors at the time. There was one in Miami and then one in, I believe it was Cincinnati, and then myself. But now, as you know, every sports team has a chiropractor on staff. So when I moved from Texas to Colorado, I had an vision to start my own practice, hang up a shingle, And I met a gentleman when we were doing our state boards. Back then, you had to go through a very rigorous, like a Part 4 board for Colorado. And we just got to chatting, and we decided, let's form a partnership. So we went in to practice together. My dad co-signed a $30,000 loan, and we started to operate out of my apartment at first. And a gentleman named Glenn Milburn was a Denver Bronco running back. He was kind of a wide receiver running back. He came in as a patient and introduced me to Terrell Davis. And for those of you who don't know Terrell Davis, he kind of came up with the Mile High Salute. He rushed for over 2,000 yards. He's now in the Hall of Fame. But he came out of Georgia, and he complained of significant migraines. And as most of us know, chiropractic can help tremendously with TMJ, adjustments of the upper cervical. So he became a patient of mine, and he started to have an exceedingly great rookie year. And during the off season, I got a call from Steve Ananopoulos, the head trainer, saying, we like what you've done with Glenn Milburn and Terrell Davis. We'd like to send 2 of our rookie linemen up to see you to kind of give you a quote unquote interview. So they brought these big, huge guys up, and I must have won them over, because I got a call a couple days later saying, we'd like to have you come down to the facility and interview for a position as the Denver Broncos chiropractor.
Well, what a great interview, and that's the kind of interview that those of us that can perform enjoy. Show me what you can do. Great. What kind of challenge do you have? So do you recall what kind of challenges they had at that point in time, or did you have to do anything unique with them?
That's a great question, because 2 years prior, I was interviewed as the Colorado Avalanche hockey team's chiropractor, and I was very excited. I went into the arena. I had worked with Claude Lemieux, who was a great hockey player. They just won the Stanley Cup, and I had worked with Claude personally. And I got a call from the trainer saying, we'd like to have you come down to interview for a position. Well, I was very excited. I ended up bringing one of the papers that I wrote in regards to how to train and exercise properly. And I brought it with me. And we just were wrapping up the interview when one of their strong guys came into the locker room. And I just abruptly stopped my interview. And I said, hey, I've got something for you. And I pulled the paper out of my briefcase, and I gave it to him. And he gave it to the trainer. The trainer looked at me, looked at the paper. He said, go ahead. And then as the player left the locker room, he looked at me and he said, hey, Doc, if you ever have an opportunity to interview with a sports team, don't do what you just did. And he said, our interview is over. And he walked me down the tunnel and out of the arena. And that was it. I had blown my chance, because what I found out, Dr. Bob, is that the trainer is always the gatekeeper, and they are always in control. You always want to make sure that you go through them first before you make your own decisions. So that was a life lesson.
Well, a good one too, right? And so I guess no matter what we're seeking, whether it's an agreement from God knows what family members on where to go, who's the gatekeeper in that circumstance? And there's always somebody, isn't there?
There is.
So now let's just transition to, you were with the Broncos for a period of time, and then were you also in private practice at that same time, or did they basically have you a full week's worth of work plus?
No, I was there 2 days a week. So I'd be there from about noon till about 6:30 or 7 o'clock, Tuesdays and Thursdays. And then I would basically manage my practice Monday, Wednesday, Friday, a scatterings of the morning on Tuesdays and Thursdays. But I just started to have a family. So there had to be a point in time where I had to basically make a decision. Was this something that was going to benefit my practice for a long period of time, or should I maybe step back? And so I became the Colorado Crush chiropractor, which was the arena football team. So I did both the Broncos and the Crush at the same time. It was overwhelming. And I started seeing my private practice numbers going down. And, the Broncos paid some money per year, but the Colorado Crush, it was all gratis. Mm-hmm. You would get swag and tickets and things like that, but it wasn't anything that was a financial whirlwind. So I decided to go ahead and leave those two adventures. And then a couple years after that, the Denver Outlaws, which is our professional lacrosse team, gave me a call and said, hey, we've heard you do great things in the community. We'd like to have you come aboard as our team chiropractor. And again, that was gratis as well. But I did that for 2 years. And it was just very, very interesting, as I've written about it in my book. about the adventures, the doors that opened, the doors that closed, sometimes my own fault. But it's been an amazing 30-year blessing for sure.
Well, and how amazing, and so many lessons in there for people, and I've said, look, when I treat the pros, they come in to actually see me in private practice. The first time I saw a pro was 1993. And so you start looking at that, and they came in and they paid in full. That part was nice. But I had a meeting with the Houston Rockets. I helped Yao Ming quite a bit at one point in time, but they didn't seem open at the time. That was probably around the year 2000, but a lot has changed so wonderfully since that point in time. So now let's go to private practice. Yeah. Is there a specific demographic that you enjoy working with?
That's a great question. I must admit, I love working with kids, but it's not my jam. It's not something I like to see. A lot of babies, a lot of kids crying in the waiting room or running around. I don't have the patience for that, I guess. But kind of my sweet spot is those athletes that are weekend warriors. Pickleball is a huge craze right now. I actually just traded the name through the government, Pickle Fit, and I'm going to go through a bunch of videos on that. But I really enjoy, the 30 to 50-year-old range. I just came back from the Villages of Florida, which is a 55 and over retirement community. Came back into Denver for a time period, but I had a chance to run a practice down there for about a year. And it was amazing because everybody's climbed the mountain there. They're very active. We've got 55 golf courses, over 300 pickleball courts. So I really fell in love with the older, more seasoned individual. But now that I'm back in Denver, my demographics is probably right about that 35 to 40-year-old range.
Well, how wonderful that what you just said, though, in all that was you do see some newborns, you do see some toddlers, you do see some geriatrics, and then you see everything in between. So we've got something for everybody. But I might just then ask the question, differentiate between those three patient types. How are you going to do your assessment? How are you going to help them out? And how do the techniques differ based on pediatric, geriatric, and elite and weekend warrior?
Yeah, geriatric, you really have to look at their medications because they bruise quite easily. For instance, shockwave or the Groston technique. You go in and you do some deep pressure to some of these more seasoned patients, and as light pressure as you might think you're doing, you might create a bruise that could become a very, very big issue down the road. So I do a lot of vertebral artery testing. I do a lot of arthrostim adjusting with the more seasoned patients, a lot of stretching. And then when you get down into the younger level, the pediatrics and so forth, what I try to do is gain their trust. I try to make sure that they understand that I'm not there to poke them with a needle, that I'm not going to give them medication, that I'm there to make their body more flexible and healthier. And then with the babies and so forth, I do a lot of, again, the pro adjuster, muscle testing, surrogate muscle testing with the parents. And then, of course, with the adult population, I do like to have pictures of their spine in order to determine their alignment, the health. I'm not necessarily a CBP practitioner where I'm going to correct curves, but I would like to see, what is underneath the muscles and skin so that I can make the appropriate care and recommendations possible for them.
What's amazing to me, going back to your own story, the value of an X-ray, the value of a picture, and you apparently had, as you said, some congenital anomalies, and so did not the medical profession take films of your back when you hurt it significantly and needed rehab at age 13?
Yeah, no, a chiropractor did it for me. Absolutely.
Yeah. And there's a good practice tip too, right? He was being of service, and that's what they say. If you're always of service, you have someone to serve. And what leverage on that, right? BJ said, you never know what you may think, say, and do, and how it may impact the lives of millions. Well, you having gone through multiple professional sports teams and impacting, I'm going to say millions through your book. How wonderful.
Thank you. And I will piggyback one thing. This is a heartbreaking story. 32-year-old gentleman came in maybe 5 years ago, and he had this really deep left shoulder ache that was burrowing through his chest. And he had been going to a local chiropractor. He came to me on a referral. He had seen this chiropractor for about 6 visits and got some musculoskeletal relief, but this pain was just really deep. I went ahead and took some pictures. I sent him off for some radiology review. The radiologist calls me up on the phone, Dr. Yoakum, and said, hey, there's a mass there. We've got to get this person over to oncology right away. Well, long story short, this gentleman had a 1-year-old little girl, was married, but he had this significant cancer growth that was basically encapsulating his lung. And unfortunately, about 6 months later, he did pass away, but he was able to get his house in order, if you will, because this x-ray did find something. And I would just tell our audience here that if you find things that are maybe unusual, something maybe sensitivity wise with the nervous system, don't be afraid to order tests.
Yeah, I think that's some of the best news ever. There's different things that we do. And I'll share a story that was also had a tragic ending. I had a gentleman come in, newly retired, neck and shoulder pain, and he had a 20-pack year history of smoking. And you know what? I just put a simple pulse ox on his finger, and it was less than I wanted. Maybe it was 95. It was still in a reasonable range, but not where I wanted it. And then I also did a body comp test, and it looked like he had been losing some weight based on what, a typical body would have. And I asked him, I says, have you lost any weight? He says, yeah, maybe a little. I said, are you trying? He says, not really. How's your energy? How's your strength? Well, his only activity was pushing the remote, so he didn't really know. I said, look, as a smoker, we're going to get a film. This man didn't even live 2 weeks. The cancer was so extreme at that point, and his first symptom was pain like that. So bottom line, we are taught to never miss, or at least be diligent enough so that we shouldn't miss anything significant going on with that. But we all need to be our own advocates. If you're not making progress, this patient did the right thing by coming to see you. I'm not sure what led him to your door. Maybe divine intervention, because I know you're a man of faith. But if you're not getting better, you need a different answer. You need a different look at what's happening, and how wonderful that he could get his life in order. I think if we were to ask most people, especially in that circumstance, if you knew you had 6 months left, would you want to know if you were within 6 months? And I think most of us would.
Yeah. There's a great country song out there talking about skydiving and all of that, but I understand, yes. And I think we, as physicians, practitioners, owe it to the community that, we can seek out answers, and we can use the medical community and other power partners to help the patient get to their goal.
So let's talk about that power partners, because we're going to have some chiropractors are going to see this. We're going to have people in business, but let's face it, you're a master networker. So when did you figure that out? How did you figure that out? And how do you go about building your power connections?
Well, that's a great question. I did write that section in the book. It's a great template. Power partners, especially in the chiropractic industry, if you think about it, pain management doctors are probably not the best power partners, because a patient has already gone through everything, and now they're at the pain management doctor. We are a self-pay cash practice, so they're very insurance heavy. So I don't identify the medical community as really a power partner. However, if you're personal injury or workers' comp, you want to find general practitioners. For instance, Dr. Bob, you get in a car accident, probably the first person you're going to call, other than your wife, is your doctor. After you've kind of settled everything with your insurance, but you're going to call your family physician and say, Dr. So-and-so, I was involved in a crash. I'm having a lot of neck pain. Can I come and see you? So the medical doctor is going to simply say, yeah, come on in. We'll go ahead and prescribe some things, but they're going to usher that patient or that person off to physical therapy as quick as possible. A good power partner, medical doctor, will refer over to a chiropractor, but we just constantly have to make sure that they understand that we would like to intercept that, case, if you will, that patient before they go into physical therapy, because a PT is not going to refer for a neurology exam or x-rays or MRIs. As chiropractors, if we can be that first treating provider, then we can filter down to other providers to help the patient. As far as power partners, massage therapists, yoga instructors, Orange Theory, you look at like the joint, for instance, maybe they don't treat personal injury cases. So the chiropractors that are listening to this podcast, if you have a joint nearby, maybe reach out to the owner and say, we would love to take over your personal injury patients that you're not going to see. And in return, we'll make sure that we send them back to you, however you want to leverage yourself. Other power partners, acupuncturists, if you think about that. If you think about the strength coaches, there's a lot of Titleist performance and golf instructors. We mentioned pickleball. Power partners, just think about anybody that you can partner up with that is going to be a good referral source back for you, because ultimately your patient load, your home, if you will, and your practice is really reflecting you. So you want to find out, who do I want to fill my bucket, and make those relationships.
Brilliant. Now, you also do dry needling. So I want you to differentiate between dry needling and acupuncture.
Okay. So dry needling is, I call it active needle therapy. What we're trying to do is produce an inflammatory response or a muscle response that's going to allow that muscle to let go. So initially, when I was certified years ago, I did a lot of the pistoning back and forth and penetrating, kind of like fishing, and you're finding that twitch. Once you find that twitch, it's like catching a walleye. You want to kind of stay in that area. What I found, though, is once I hit that muscle twitch, then I'll surround that area and I'll put lead cords, electricity through that muscle for maybe 10 to 15 minutes. And I'll just use that electric current, depending on the frequency, to get that muscle to let go. So I don't do a lot of pistoning back and forth like I once did. A lot of them is basically set that needle in and then go ahead and put the stim on it. And it's amazing the results we get.
Yeah. My rule in clinical practice is, when in doubt, acupuncture. But I think what you said, the difference is you're just really like a surround the dragon technique, hit the trigger point, unwind it, and then that electrical stimulation, brilliant as well. There's so many different things you can add. Have you ever played with moxa by any chance?
I haven't. I have not.
That's a little, well, now it's legal in Colorado, but it smells like marijuana. I had an acupuncturist in the 90s working with me, and I'd have some patients come in and they'd say, okay, what is that? Okay, that's moxa. It smells like marijuana. Okay, fair enough. So we had to ask the acupuncturist to do it after hours because patients were getting a little concerned with this. So let's talk a little bit about the soft tissue techniques. You were one of the first guys in Colorado to use instruments, something called Graston, and share what that is, what that does, and how people benefit.
Well, Parker University now had incredible seminars. They still do. But back in the day, these seminars were just gigantic. And there was all sorts of resources for young docs coming out of school to establish relationships with other techniques. And so I remember Tom Hyde was in a booth, and he was doing some very specific Graston work with a stainless steel instrument on somebody's extensor, the elbow. And I just sat there fascinated going, wow, I've been using my thumbs and my elbows and things like that. It makes total sense because the vibratory sense that you get through a stainless steel instrument is extremely beneficial. So I immediately signed up for the course, and I did the Graston. I was one of the first practitioners here in Colorado to offer it. I don't do a lot of bruising or deep tissue now. A lot of times I'll work kind of like a nice pink coloration to the tissue, and then I'll stop. So I'm not going to get in there and break down that tissue and expect them to come back. That's just not how I practice anymore.
Well, that's how they used to do it, right? I had Graston in the 90s, and I walked away looking like I'd been in one of the worst fights of my life and bruised, even though it was effective. But are you finding that the effectiveness probably is better because of better compliance, or do you think there is justification for going deep like that on occasion?
I think you need to peel the onion. I think you need to just work on the superficial fibers, allow the receptors to, enable you to go deeper at each treatment, just like with the shockwave therapy that we do now. You can set the bars, and it's a marathon. It's not a sprint. And I try to tell these practice members that, look, this has been a long time that your body has been engaged in this type of posture. It's going to take a long time for us to remove the tension out of those tissues. And what we don't want to do is create so much inflammation and pain that is not going to help you in the long run. So I try to set the stage before the patient receives that first treatment that, we are here to help you and navigate you through your treatment goals. And in doing so, you have to be patient.
Well, I think that's wisdom. And there is sometimes with what we do, such a thing as a free lunch. You can get one part of the spine to let go and the rest just cooperate so much more. And it can be the same thing with tissue as well. Do you back that up with any type of proteolytic enzymes or anything?
Oh, absolutely. You have to. There's no doubt. I mean, gone are the days of not supplementing. And as practitioners, I would highly recommend that all of us continue to take refreshing courses, because there's all sorts of great information. Dr. Mercola, Pioneer, he gives us this great information. Subscribe to these type of resources and use them.
Yeah, I was at the conference where Mercola announced his website. And he had big plans. It happened to be in Chicago, right in his backyard, and it was well over 30 years ago. And he says it was a new idea. We're actually going to build the biggest health website in the world, is what his plan was. And he's certainly been up there. Yeah. I want to talk about enzymes for just a moment, because one of the things they know is this is one of the most powerful things for long COVID. And what I like to tell people is, if you take enzymes with food, it digests food. You take it away from food, the systemic benefits, right in the medical literature, is they use the word appears limitless. Mm-hmm. So many things that we can do. So how about a story or two about some of your favorite cases to wrap up this wonderful conversation?
I have a lady that came in with frozen shoulder 3 months ago, and she had a left frozen shoulder. This one happens to be the right. This was multiple years ago, and I'm MUA certified, so manipulation under anesthesia. So long story short, I was able to bring her into the center where they would give her basically Propanol to give her a twilight sedation. And I was able to go in and mobilize that shoulder, and I was able to literally rip that scar tissue apart through multiple MUAs, and now she's completely pain-free. So that's been a really neat story. Again, a great certification for some of the docs out there, the MUA. And then since we see a lot of athletes, we've been using our shockwave a lot. And I use the KDT program, so I use the decompression, and I'm actually a teacher for KDT, but I love their shockwave, the radial shockwave. So we had I think a 63-year-old pickleball player that came in with severe plantar fasciitis. And so what we did was we started using the shockwave, the Groston dry needling, and then the proteolytic enzymes. And within about 6 treatments, she was basically back on the pickleball court. So the No Bones About It book that I wrote is really that. It's not just about manipulation or mobilization, but there's so many avenues that we as chiropractors can explore, and it's exciting. Every day my prayer is, Lord, you send them and I'll serve them. And I never know exactly what might come through the door.
Well, one of my great mentors, again, I'll repeat the quote. He said, be of service, you'll always have someone to serve. And Dr. George Goodhart, I think somewhere here in the path, he had to be one of your mentors, as you clearly do some muscle testing and things like that. But he said, if you want essentially to build your business, provide more service, and that will just bring people in and differentiate you. So what's the best way for people to reach you?
My website, my book website is probably the best way, because it has all my contact, and it's the 3 W's and then JT Anderson with an O, .biz, B-I-Z.
All right. Very well done. And, I'm going to wrap up with the words that I always used. I'm Dr. Bob Rakowski, absolutely knowing that we can all be happy, healthy, and successful. So if you're watching this some part of the world where it's daytime, have a beautiful day. And if it's nighttime, sweet dreams and God bless.
Thank you.